educating our patients on the timeline in which they might experience diarrhea, educating them on what to do. So I typically tell my patients about antidiarrheal prophylaxis, the importance of utilizing that prophylaxis at time of first diarrheal event and then subsequent diarrheal event, and maximizing agents like loperamide first. I often will discuss the use of Lomodal as well if needed, if they experience more frequency of diarrhea despite the loperamide. We talk through how diet might impact diarrhea as well on capivasertib, and the use of a food diary for them to get a better sense of the foods that might trigger that diarrhea for them. And I think patients find it very empowering to actually understand the toxicity profiles, particularly with diarrhea, which may impact quality of life earlier on, so they're not surprised by that, and they know that there are certain things that are in their control to hopefully help minimize the quality of life impacted by diarrhea with this drug.
Great, great overview. Anything to add to that, Reshma?
I think the other part that we probably haven't touched on is the schedule and having that 4 days on, 3 days off. I find that patients really like that time off, and it gives them a little bit of a break, and they also are able to kind of get a clearer sense of how they're feeling on drug versus off drug. So I know there was some concern when the drug was first approved about whether that would be a difficult thing for patients to follow, but I think our breast cancer patients are highly motivated and very organized, and so I don't think it's been a barrier at all.
Something under their control, right? I find that the dietary approaches often are well received because at least it's something that they can modify themselves. You know, I think the other point, putting together two important points that you raised, Manali, with regard to diet is, you know, I find, and I'm a huge proponent of a high fiber diet, except in the context of new onset diarrhea, which can exacerbate, right? And the recommendation is to actually pull back on your fiber intake if a patient is having diarrhea. This, I think, is why it's so incredibly important to do what you said, and that is to optimize the diet and glycemic control well before you start capivasertib. And we can do that during first-line therapy, advise for a low glycemic, high fiber diet. The last thing I want is for my patient to immediately start a high fiber, green forward diet right when they're starting capivasertib. So I think the timing does matter here.